Start. Good morning, everyone. Today we are going to start with the project. The uh, name of the project is Healthcare Availability in India. So now our the objectives and the research will be done by Kanishka. Let's start.
Good evening, everyone. I am Kanishka, and today I would be telling you about the objective of the study. This project aims to maximize the knowledge of the group members in context of healthcare availability in India. It includes extensive research and understanding of the topic so as to deliver a shared perspective in front of the class via a presentation. Research methodology, type of data, primary and secondary data collection sources. One, primary data, survey through Google Forms. Two, secondary data, internet websites, foundation course book from Manan Prakashan. Sample was collected from 42 respondents.
So good morning, everyone. My name is Taha, and today I'm going to start with the introduction of the healthcare. So basically, healthcare system or organization established to meet the healthy needs of targeted populations. According to World Health Organization (WHO), a well-functioning healthcare system requires a financing mechanism, a well-trained and adequately paid workforce, reliable information on which to base decisions and policies, and well-maintained health facilities to deliver quality medicines and technologies. An efficient healthcare system can contribute to a significant part of a country's economy, development, and industrialization. Healthcare is conventionally regarded as an important determinant in promoting the journal, physical and mental health and well-being of people around the world. An example of this was the worldwide eradication of smallpox in 1980, declared by the WHO as the first disease in human history to be eliminated by deliberate healthcare interventions. India has a multiplayer universal healthcare model that is paid for by a combination of public and private health insurance funds, along with an element of almost entirely tax-funded public hospitals. The public hospital system is essentially free for all Indian residents except for small, often symbolic co-payments in some services. At the federal level, a national publicly funded health insurance program was launched in 2018 by the Government of India called Ayushman Bharat. This aimed to cover the bottom 50%, that is 500 million people of the country's population working in the unorganized sector, and offers them free treatment at both public and private hospitals. Now moving on to the next slide. Indian healthcare system is mainly divided into three categories: public healthcare, private healthcare, and indigenous healthcare. Now there are some moving on to the next slide. There are some initiatives taken by the government. So the rural-urban difference is developing more equitable healthcare infrastructure between urban and rural areas. Convert primary healthcare centers into community health centers. Then the public healthcare facilities and treatment quality, improving critical care facilities and addressing services level in public channels by effective utilization of public infrastructure. Thank you. This is all from my side. Now moving on to Riddhi.
Good morning, everyone. My name is Riddhi, and today I am going to speak about the primary healthcare. Primary healthcare sometimes refers to as a public healthcare, which are state-owned rural healthcare facilities in India. They are essentially single physician clinics, usually with the facilities for minor surgery. They are also a part of the government-funded public health system in India. As on 31st March 2019, there are 30,045 PHCs in India, in which 24,855 are located on rural areas and 5190 are on urban areas. So the definition of the primary healthcare is, it is an essential healthcare based on a practical, scientifically sound and socially acceptable methods, and technology made universally accessible to individuals, families in the community through their full participations and at a cost that the community and country can afford to maintain at every stage of their development in the spirit of self-reliance and self-determination. The basic terms in the definitions are: Essential healthcare. Essential healthcare is a group of function essential for health of the people, given at a lower level of health service. Scientifically sound, scientifically explainable and acceptable. Socially acceptable methods and technology are intervention should consider the local value, culture and belief. Universally accessible. Because of the inequitable distribution of the available resources, the services are not reachable by all who need them. Next slide. Next slide, Kanishka. Here are some of the primary healthcare center programs which are listed below. Provision of medical care, maternal child health including family planning, safe water supply and basic sanitation, prevention and control of locally endemic diseases, collection and reporting of vital statistics, education about health, national health program as relevant, referral services, trading of health guides, health workers, local and health assistants, basic laboratory workers. So what is a subcenter? A subcenter is a public sector which is most peripheral and first contact point between the primary healthcare system and the community. As per the population norms, one center is established for every 5,000 population in plain areas and for every 3,000 population in hilly tribal desert areas. Next. These are some of the facilities which are available previous wala. These are some of the facilities which are available at sub-center. Mother and child care, safe delivery, universal immunization program, family welfare services, Janani Suraksha Yojana, primary medical care, birth and death registration, micronutrient services like distribution of vitamin A, iron and folic acid, dots provided for tuberculosis, and collection of data and vital statistics. These are some more services which are provided at a sub-center. Antenatal care. Early registration of all pregnancies, ideally within the first trimester. Minimum 3 antenatal checkups. Associated services like general examination, such as height, weight and BP, etc. Intranatal care. Promotion of institutional deliveries. Skilled attendance at home deliveries. Appropriate and prompt referral. Postnatal care, minimum of 2 postpartum home visits, counseling on diet and rest, hygiene, essential newborn care, etc. Others, provision of untied fund to the subcenters. Thank you.
Community Health Center is one of the network clinics staffed by a group of general practitioners and nurses providing health care services to people in a certain area. Typical services covered are family practice and dental care, but some clinics have expanded greatly and can include internal medicine, pediatric women's care, etc. Rural health. As healthcare is the right of every individual, but lack of quantity infrastructure, dearth of qualified medical functionaries, and non-access to basic medicines and medical facilities towards is reach to 60% of population in India. Due to non-accessibility to public health care and low quality of healthcare services, a majority of people in India turn to the local private healthcare sector as the first choice of healthcare. District hospitals. District hospitals are the final referral centers for primary and secondary levels of public health systems. It is expected that at least one hospital is in each district of India. Although in 2010 it was recorded that only 605 hospitals existed when there are 640 districts. Teaching hospitals. A teaching hospital is a hospital or medical center that provides medical education and training to future and current health professions. Teaching hospitals are almost always affiliated with one or more universities and are often co-located with medical schools. Those that attend a teaching hospital or clinic would practice medicine under the direct or indirect supervision of a senior medical clinician registered in that specialty. Specialized hospital. Specialized hospital means any hospital devoted primarily to specialized care and treatment of persons with chronic or long-term illness, injury, or infirmity. The diagnosis, treatment, or care shall be administered by or performed under the direction of persons specially qualified in diagnosis and treatment of a particular illness, injury, or infertility. Now I pass on to Swaleha.
Thank you, Kanishka. Moving on to the private healthcare system in India. A private healthcare system involves private hospitals not owned by government, including for profits and for non-profits. Funding is done by patients themselves or by insurers or by foreign embassies. Private hospitals are majorly part of the healthcare systems all around the world, although in varying degrees. Next slide. As shown in the data given below, India has a total of 43,486 private hospitals, 1.18 million beds, 59,264 ICUs, and 29,631 ventilators. On the other hand, there are 25,778 public hospitals. In India, the capacity of most public and private hospitals is same in the state besides Chandigarh and Puducherry, whereas the private hospitals have more capacity than the public ones. Next slide. The Indian private healthcare system consists of private hospitals, polyclinics, nursing homes, general practitioners, and clinics. Next slide. Coming on to the private hospitals. The hospitals in India have a range of departments such as surgery care unit, cardiology units, intensive care units, also known as ICUs, radiology, and chronic treatment unit, etc. The private hospitals in India have professional surgeons and doctors, also nurses who provide the best treatment and patient care. Next slide. Polyclinics. A polyclinic is a clinic or a healthcare facility that provides both general and specialist examinations. It is usually independent of a hospital and it is set up by a group of physicians such as dermatologists, ENT specialists, dentists, psychiatrists, etc., who run the practice under a single registration. Next slide. Nursing home. They are also known as skilled nursing facilities, SNF, or old people's homes, or also a convalescent care center. Often these terms may convey slightly different meanings to indicate whether those are run by public or run privately. Generally, these are used by people who do not need to be kept in a hospital but cannot be cared for at home. Next slide. General practitioner. A general practitioner manages types of diseases that may be present at early stages of development or undifferentiated way, which requires urgent intervention by the GP. Their duties are not only confined to specific organs of the body, and they have particular skills in treating patients with multiple health issues. Next slide. Coming on to the clinic. Clinics in India, also sometimes known as outpatient clinics, are mostly the small private or public health facilities for the outpatients. Clinics typically cover the primary care needs such as health patient counseling, disease prevention. They cover the needs of the population in local communities, in contrast to larger hospitals, which offer more specialized treatment. That's all from my side. Thank you.
Ayurveda. Ayurveda is heavily practiced in India and Nepal, around 80% of population using it. These therapies include herbal medicine, special diet, meditation, yoga, medical oils, etc. Ayurveda preparations are typically based on a complex herbal compound, minerals, and metal substance. As you can see, there is a photo of Dhanvantri, an avatar of Vishnu, is the Hindu god which is associated with Ayurveda. Next slide. Unani and TB. Unani medicine, also called as Unani TB, Arabian medicine, or Islamic medicine. As a field, it was later developed and refined through systematic experiments by the Arabs, most prominently by Muslim scholars, physicians. The bulk of a Greek knowledge was translated into Arabic, part of that knowledge being the principle of medicines with addition contribution of medical wisdom from other part of Middle East and South Asia. Next slide. Siddha. Siddha medicine is one of the most ancient medical system of India. Siddha is also known as Mother of Ancient Tamils and Dravidian of Peninsular South India. The word Siddha means established truth. The person who were associated with establishing such Siddha schools of thought were known as Siddhas. Next slide. Homeopathy. Homeopathy developed in late 70s in Germany. It's common in many European countries, but it is not quite as popular in US. Basic belief of behind homeopathic is like curse, like in other words, something that brings on symptoms in a healthy person can, in a very small dose, treat an illness with the similar symptoms. This is meant to trigger the body of natural defense. Next slide. Yoga. Yoga origin can be traced to a North India over 5,000 years ago. The word yoga was mentioned in ancient sacred texts called Rig Veda. The Vedas are a set of four ancient sacred texts written in Sanskrit. There is a good research that yoga may help you manage stress, improve your mood, curb emotion, eating, and create community of support, all of which can help with the weight loss and maintenance. Yoga can also help you in burn calories as well as increase your muscles and tone. That's all from my side. Hand over to Janvi.
Market size of healthcare industry in India. Next. The healthcare market can increase threefold to rupees 8.6 trillion by 2022. In budget 2021, India's public expenditure on healthcare stood at 1.2% as the percentage of the GDP. A growing middle class coupled with rising burden of new diseases are boosting the demand for health insurance coverage. With increasing demand for affordable and quality healthcare, penetration of health insurance is poised to expand in the coming years. In FY21, gross direct premium income underwritten by health insurance companies grew 13.3 to 58.572 crores. Next slide. The country has 393 Ayurveda and 221 homeopathy government recognized colleges. As of April 2021, over 75,500 health and wellness centers were operationalized in India. India is a land full of opportunities for players in the medical devices industry. The country has also become one of the leading destinations for high-end diagnostic services with tremendous capital investments for advanced diagnostic facilities, thus catering to a greater proportion of population. Besides Indian medical services, consumers have become more conscious towards their healthcare upkeep. Next slide. Key players in healthcare Apollo. Apollo Hospital Enterprises Limited is healthcare provider. It is engaged in offering healthcare services and operating standalone pharmacies. The company's segments include healthcare pharmacies and others. The healthcare sectors consist of hospitals, hospital-based pharmacies, projects, consultancy services. It is tertiary care hospital. Fortis. Fortis Healthcare Limited is an integrated healthcare delivery service provider. The company is engaged in establishing, maintaining, operating, running, managing, or administrating hospitals. Next slide. Key opportunity segments. The key opportunity segments are pathology services, hospital services, and health insurance. Moving on to conclusion.
India's public expenditure on healthcare stood at 1.2% as a percentage of the GDP. In the Union Budget 2021, investment in health infrastructure expanded 2.37 times year over year. The total health sector allocation for financial year 2022 stood at 2,23,846 crores. The government announced 64,810 180 crores only outlay for the healthcare sector over the 6 years in the Union Budget 2021-2022 to strengthen the existing national health mission by developing capacities of primary, secondary, and tertiary care healthcare systems and institutions for detection and cure of new and emerging diseases. Now, Janvi will further elaborate on the conclusion.
In Union Budget 2021-2022, the government announced its plans to launch Mission Poshan 2.0 to merge supplementary nutrition program with Poshan Abhiyan in order to improve nutritional outcomes across 112 aspirational districts. The Government of India approved continuation of National Health Commission with a budget of 37,130 crores under the Union Budget 2021-22. In Union Budget 2021, the Ministry of Ayush was allocated 2,970 crores, up from 2,122 crores. Moving on survey.
Yeah, so this is the survey we conducted by in the people. So on it's the first question is on the scale of 1 to 10, how healthy do you consider yourself? So out of 42 respondents, 33.3% consider themselves to be healthy, and 21.4% are considering themselves more healthy than the others. Moving on to the next slide. Do you have any hereditary conditions or diseases? So out of 42 respondents, 42.9% don't have hereditary conditions or diseases.
Next question was, are you habituated to drugs and alcohol? Out of 42 respondents, 92.9% are not habituated to drugs and alcohol. How often do you get a health checkup? Out of 42 respondents, 71.4% get their health checkup regularly.
Overall, how do you rate the local hospitals in your area? When inquired, the above question, 61.9% of the police found the hospitals in their areas to be average. How would you evaluate your overall health? Would you say you are out of 42 respondents, 73.8% consider themselves in a good physical health?
In your opinion, at what capacity can you perform everyday activity? Out of 42 respondents, 59.5% can perform everyday activities in good capacity. Next. Which health insurance coverage provider are you currently enrolled with? Out of 42 respondents, 33.3% are enrolled with a Star Health and 33.3% are with Medicare.
How satisfied are you with the skill and competency of the staff at hospitals? Out of 42 respondents, 40.5 somewhat satisfied with the skill and competency of the staff at hospitals and 40.5 are neutral. How often do you have trouble taking medicines the way you have been told to take them? Out of 42 respondents, 61.9 claim that they take medicines as they are prescribed.
Next, now overall, how would you rate your experience of getting prompt attention at receiving health services in the last 12 months? Out of 42 respondents, 40.5% gave prompt attention in receiving health services in the last 12 months. Next. In the last 12 months, do you need any laboratory tests or examinations, like blood test, X-ray, etc.? So out of 42 respondents, 66.7% don't need any laboratory test or examinations. Is there a difference in performance between the available hospitals in your area? So out of 42 respondents, 54.8% found a significant difference between the performance of the hospital in the area. Next. How many times have you or other members of your family been a patient in a hospital in the last 3 years? Out of 42 respondents, 64.3% responded none of their members in the family has been the patient in the hospital for the last 3 years. Here is the bibliography of the links. And thank you guys. This is all from the group 2.
Thank you.
Thank you.
Thank you.